This week we're going to talk about the mask. When to wear it, where to wear it, and where did they get the information to say we can take the mask off? Well, we got the word from the CDC. The updated guidelines state that if you've been fully vaccinated, you can now take the mask off either inside or outside, large or small groups. There was a study done in Israel, and they looked at 5,000 healthcare workers, and they looked at the results of these 5,000 healthcare workers with regards to after they had been vaccinated. As it turned out, the vaccine was 97% effective. It was 96% effective in those patients who would have been asymptomatic. In other words, they contracted the virus, they really didn't have any symptoms, but they could spread it. This study that was done in Israel, which you can find in the link below, it was published in JAMA, the Journal of American Medical Association, was really good evidence showing that this vaccine does work. There was also a study done in the United States, and it involved 4,000 hospital workers, and it showed that getting the vaccine was 90% effective in those healthcare workers contracting the virus and becoming sick. That's pretty darn good in terms of stopping this virus. We also had a third study that was done, which showed after patients had the Moderna and Pfizer vaccine that the hospitalization rate was 95% effective. In other words, those patients that, remember when we were in the midst of this, people were going to the hospital. They couldn't find enough room for to hospitalize patients that were sick. This study showed patients that had the vaccine, it was 95% effective in keeping those patients out of the hospital. We've heard a lot about the variants and the mutations. Is the vaccine going to be effective against these variants? As it turns out, there was a study done, and it was published in the New England Journal of Medicine. The link is below. And it showed that the Pfizer vaccine, it actually looked at the Pfizer vaccine, and it was 89.5% effective against the B117 and 76% effective against the B135. Significantly effective against the variant. Also, they looked at severe disease with these variants. 100% effective in stopping severe disease. So now we have evidence that not only does it work, it also works against the variants that and these mutations that we I think most people had in the back of their minds, because you hear so much in the news and the media and people talking about the variants and the mutations. If I get the vaccine, is it going to be helpful against the variants? But now we have evidence. If you've been vaccinated, fully vaccinated, it's going to be very difficult for you to get sick, to spread the virus to other people, and also you're covered in terms of these variants and mutations so far. There's a couple caveats in there. If you work in the hospital or a doctor's office, you got to wear the mask. If you're traveling on the airplane, wear the mask. If you're on a bus or public transportation, you got to wear the mask. These things, they make sense to me, and some of these things we have to kind of use common sense. I mean, if you're working at a doctor's office and you're around all sorts of people that may be carrying virus and you don't know if they've been vaccinated or not, we need to wear masks. And same thing with being on a bus or on an airplane. There's a study being done now. It's called PreventCovidU, and it's being done on college campuses. There's 22 college campuses in the United States where this is being done. And they're going to be looking at 12,000 students, and they're going to split the students into 6,000 on each arm of the study. And they're going to look at how much exactly, what the viral load is, and can these students pass, how easy is it for them to pass this on. So there's going to be, without getting into the details of the study, and really the point of me mentioning this is to give you more information that there is a study currently being done in the United States, and it involves 22 universities, and they're looking at, once a person is vaccinated, how low is that viral load and can it be transmitted? And so they're looking at these 12,000 students, and then they're looking at another 25,000 students that are people that are surrounding around them, people they study with, people they go to class with, people they eat lunch with. What this study is going to answer is give us more information about the viral load after you've been fully vaccinated. It's going to tell us about that viral load and how much infection one can get. And then also it's going to tell us about, if you've been fully vaccinated and you do have some virus, how much of that is transmittable? How much do you transmit? So one other thing that I want to mention, there's so many different things involved with this virus, and I like to hit the points of where people are kind of a little confused about. All throughout this whole pandemic, there was states were kind of given the freedom to do certain things the way they wanted to do them. It wasn't consistent across the board. And I've heard Dr. Fauci, and I've heard other people from different agencies talk about that was one of the things that we probably could have done better, made things more consistent. Now that we're talking about these masks, some states they have the autonomy to say that we're going to continue to wear a mask, and for reasons, they give their reasons. And some states are saying, we're lifting the mask off. Here is another problem that might be a little dicey for the states, is businesses. The CDC has given their guidelines and their recommendations, but for some businesses, they are still saying no mask, no entry. They have their rules and their protocols that they've put in place, and the employees have to follow those things right now. Personally, I think it would be good if the state has clear-cut guidelines for what businesses can and can't do, instead of one business does this and one person's allowed to do that, and that makes it confusing for the people. Nevertheless, we are moving down the line. We're in a much better place than we were 6 months ago. I think we can all be grateful for that. And I think if we continue to work at getting the people that are not vaccinated, getting them vaccinated. If you know somebody that's, because a lot of people said, I'm going to wait and see what happens. Well, you can see that things have gotten significantly better with this vaccine. So if you're not vaccinated, get vaccinated, get on board, so we can get on down the line with our normalcy in life and all the things that we were doing before this COVID-19 hit us. So as usual, if you found this information helpful, like, share, and subscribe. We'll see you next week.